Those are all the features of a subungual melanoma. Okay, that is called Hutchinson's sign. Okay, progressive widening nail fold pigmentation, progressively widening nail fold pigmentation forming a pigmented macule and associated nail dystrophy is called the Hutchinson sign, which is very classical of a subungual melanoma. And the only cure for malignant melanoma currently is appropriate surgery. Okay, and sentinel lymph node biopsy is very debatable area. I'll come to it. Okay, so patients with clinically staged with localized stage 1 or stage 2 disease do not require any further test unless they are symptomatic. Okay, no, that mean I mean no LFT or LDH is required. But patients with advanced stage 3 disease or who have clinical symptoms, okay, of a distant metastasis, okay, should undergo further imaging. Otherwise, localized disease without any symptomatic distant metastasis need not undergo further evaluation. So, what is the local treatment? For an in situ lesion, the margin is 0.5 centimeter. For less than 1 mm, 1 centimeter margin. For 1 to 2 mm, 1 to 2 centimeter margin. If the lesion is more than 2 mm, whatever be the thickness of the lesion. Means by size, I mean thickness. Okay, Breslow's thickness. The thickness is less than 1 mm, margin is 1 mm. When it's 1 to 2 mm, you go for a 1 to 2 mm. When it is more than 2 mm, always the margin is 2 centimeters. Okay, up to even more than 4 mm thickness, okay, margin is only 2 centimeters. And in my melanoma, most micrographic surgery is primarily used for in situ lesion, okay, and cosmetically sensitive areas. As far as the regional lymph node clearance, okay, a regional lymph node involvement is proportional to the Breslow's thickness, and the sentinel lymph node biopsy doesn't show any survival benefit. Okay, so according to Bailey, sentinel lymph node biopsy in melanoma is currently a staging investigation for patients with tumors of Breslow thickness more than 1 mm. By sentinel lymph node biopsy, we mean that there is no obviously palpable lymph node. When there's obvious palpable enlarged lymph node, sentinel lymph node biopsy is out of the question. Okay, so when there is no palpable lymph node, okay, sentinel lymph node biopsy can be used as a staging investigation for tumors with the thickness of more than 1 mm, according to Bailey. Okay. And Sabiston also almost goes the same line. There's a general consensus that sentinel lymph node biopsy is appropriate for patients with intermediate thickness, that is 1 to 4 or 1 to 2 mm. Okay, we have seen what is the intermediate thickness of the 1 to 4 mm. Okay, when more than 4 mm is thick. Okay, sentinel lymph node biopsy is suggested for 1 to 4 mm. Okay, same as what the Bailey says. Okay, however, the role of sentinel lymph node biopsy in thin, that is less than 1 mm, or thick more than 4 mm has been some source of controversy. Okay, so definitely 1 to 4 mm it has a role with no palpable lymph nodes. Less than 1 mm or more than 4 mm, it's not very clear. We have already discussed that surgery is the first line therapy. So adjuvant therapies, what are all the adjuvant therapies which are used? Okay, these are all mainly monoclonal antibodies which act at particular level points of cell cycle. Okay, like dobrafenib or vemurafenib, which blocks the BRAF action, or tramitinib, which blocks the MAPK signaling pathway, or ipilimumab, which blocks the anti-CLT4. Okay, you see this picture. BRAF inhibitors, vemurafenib, dobrafenib. Okay, RAF inhibitors. Or you have this tyrosine kinase receptor inhibitor, which is imatinib, sunitinib, okay, nilotinib, and danatinib. or your MEK protein inhibitors in the form of trametinib. Okay, these are all the various adjuvant therapies which are available. But as far as the US FDA is concerned, it has approved only high dose interferon alpha, only adjuvant systemic adjuvant therapy approved by the US FDA is high dose interferon alpha 2B. And outside of clinical trials, NCCN guidelines recommends only interferon therapy and radiotherapy as adjuvants, okay, for malignant melanoma patients with stage 2 or stage 3.